Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, good morning, Dave. Good morning, everybody out there listening.
One thing that has happened in the last several years, I think the medical industry has been pushed towards results, not just Band-Aids, but results. That's why I absolutely love when you say thrive, not just survive. That's kind of the mission at Okoboji Wellness Clinic.
Absolutely. It's a reminder for this is the new path forward, I believe, and so many people are seeking out not just another pill for an ill. You know, they want real solutions. They want results, and we are here as a guide to help in that path, because the real hero of the story is that guest that comes in that's seeking results, that's frustrated, that is just feeling like they're spinning their wheels, and it's a great framework that we work here with the right team and the right tools to help folks on that journey. And again, that journey, it's a co-creation. We're working together to get those results, and it can't come from, traditionally, Dave, I go to the doctor to get something fixed, just like going to get my car fixed, the oil changed. The perspective is changing now, and I think that's a good thing. I think that we welcome folks that come with an end goal in mind. That's what we encourage. And with us there to help, again, educate and provide services that can help on that healing journey. So everybody is unique. What services we may recommend for everybody is a little bit different. But there are some things that are fairly common in the whole landscape of that journey. So, for an example, another really good story with a tool on ozone and prolozone, which is injecting ozone gas, which is it's supercharged oxygen, 3 oxygen molecules. We do prolozone, so we started off with an anti-inflammatory solution. It's got some minerals and vitamins in it, a little numbing medicine called Procaine, and followed up with ozone gas. Well, one particular gal came in, I would say in the last 2 to 3 months, sharing that since last spring, she'd not been able to work. Now, she works as a cashier, and she was trending towards potentially having a stimulator, a spinal cord stimulator, placed in the back for pain. So the pain was so debilitating that she couldn't do her job. And so that was her why. She wanted to be able to get back to work, and she wanted some results, and she hadn't been seeing results. And so she brought herself in, and she became the hero of that story. She did some things to work with strengthening of the back, and then followed the course of the recommendations for ozone therapy. And by golly, this week, I believe, is the week she is heading back to work. So no spinal cord stimulator. We were able to create this space in her back where things were activating like stem cells and increasing oxygen levels, decreasing inflammation. And the really interesting thing about prolozone, Dave, in ozone injections for pain, joint pain, back pain, it tends not to always it's not like a steroid shot. It is literally going in there and putting into motion a lot of mechanisms that help the body find balance and get into a space of healing, and that's because we're adding oxygen and other contents. So great story. I think she's at about 70. She says 75% improvement. She's not constantly thinking of her pain all the time. We want to get her to 95 to 100%, so we're going to go for that. But it's just, that's another example of, okay, she came in and that was, she was needing results. She really wasn't wanting to have a spinal cord stimulator placed, and she did that. She got that there on her own because she was willing to take that journey and reclaim control. So oftentimes, again, that, in the past, again, I always say there's a time and a place for both traditional and holistic. You need to walk both paths sometimes. So, but sometimes, things like ibuprofen, meloxicam, those things are more masking the symptoms versus really maybe getting some temporary relief versus really getting to the heart of the matter. So when folks come in, a lot of times what I've noticed over the last 3 to 4 years, Dave, is that folks are really wanting vitality, they're wanting strength, they're wanting emotional well-being. Those are big factors for folks, and that's really where they're defining real health. It's not just the absence of symptoms. Again, it's the physical vitality. It's the emotional well-being, the ability to live life fully without restriction, physically or emotionally. And so, the team that we have here is looking to, again, help guide that guest down the road. One area we've always touched on is digestion and gut and how many toxins are out there that our body is having to detox and deal with all day long. Well, another aspect is that gut-brain connection. And so very oftentimes, Molly Avery, our functional specialist nutritionist, was in to educate our team earlier this week, talking to us again about the importance of the brain and how much there is a connection to the brain and the gut. So if you have prior trauma, physical, emotional trauma, stress in the life, and you've got some stuff going on with the digestion, you're out of balance there, what we call a leaky gut, those things are oftentimes connected, and we get into this space where it's a sympathetic dominance, meaning our nervous system is in overdrive. And when our nervous system is on overdrive, sometimes that can be triggered by imbalance in the gut. It can be, again, other triggers, other stress. Then we get into these loops that can affect things like pain or sleep. And we can't really be in a healing state if we're in sympathetic dominance. We need to work towards parasympathetic in this balance where the body can get into a state of healing. And this is where our team member, Michael Sheridan, comes in a big way, utilizes his tools with reflexive brain work. And a lot of times folks will come in who doesn't have stress or trauma in their life. And I'm recommending they sit down, our guests, with Molly, with Michael, and then, of course, sitting down and digging into things deeper with me. But we're seeing some incredible results when we're applying a tool like ozone or hyperbaric therapy, along with the dietary nutrition changes, lifestyle changes. And then they work with Michael where he is trying to get the brain out of that loop. And we have other tools like the brain gauge. We've got ISS neurofeedback, which has been phenomenal for stress support. So this combination all together is huge for getting folks those results, getting them on that journey that they desire to be on, where we're the guide. We're here. We're not the hero. We're here. God has placed us here to help folks on their journey to living their fullest. And so that means that, again, we're co-creating together. The folks that come in are doing the hard work, and they may say, hey, this might be working a little better for me than this, and vice versa. So we may have to adapt, pivot, and change as we go through the course of the process to bring oneself into balance and feeling they're optimal. But the whole journey together, again, is something that I think is so exciting right now in the landscape of wellness, as medicine is starting to change and look a little bit different as the expectation changes for the individual that is out there. They're challenging their provider and saying, "Hey, I learned about this on social media. What do you think about this? Do you think this could be good for me?" So we're always in the space of learning, and it's just an incredible, amazing time to be in this practice, as we say, David. It's just sometimes like drinking water out of a fire hose, we feel, because there's so much for us to learn. But sometimes the most basic things, we can impact folks' quality. And so come join us on the journey to impact that quality for yourself, where you are getting the results. You are in a space where you are feeling you're whole.
Yeah. One thing, and we're already out of time, but we had mentioned before we went on that Michael's very helpful with is the situation where when people seem to be constantly in that fight or flight mode. And the thing is, in a natural environment, that is a God-given thing. When we walk out in the wilderness and see a lion, we are supposed to have that fight or flight mode. But living every day 24/7 in a fight or flight mode, that is not intended to be.
No, we got to break that loop. That's not the balance we need, because if we live in that space long enough, our body starts to wear down, and that's where inflammation and disease can start to come in, and stress and anxiety can ramp up, and then we're not in a space we want to be.
Yeah, that's exactly right. So that would be a great cycle to break, and I know a lot of people have been there or are there. So if folks want to come visit with you, get on their journey to thriving in their days, what's the best way?
Yeah, absolutely. We are so looking forward to getting to meet you and continuing to work with you. Those that are already coming, you get to determine the pace, like we always say, but sometimes it's like we'd like to learn a little bit more about how do I even get started. And so that might be a discovery call with me at 712-339-6024, 15 minutes to kind of just review where you're wanting to be, what's your why, and then we'll fill in the gaps and kind of create that roadmap when you come in for that first hour-long visit. But we're at 3305 Berquist Avenue in Spirit Lake, just off Highway 71. Again, that discovery call is complimentary. Excited to get more folks well, more folks in balance, so they can go out and do their given amazing abilities and share those. Let God's light shine through them, and you're more apt to do it when you're feeling better. So,
boy, that is true.
Give us a call.
Absolutely. Dr. Meyer, always a pleasure. Have a wonderful day, and we'll chat again next week, one day before Thanksgiving.
Everybody have a great week. Be well.
Thank you, Doctor. Dr. Bradley Meyer of the Okoboji Wellness Clinic. You can find them online as well, okobojiwellnessclinic.com.